Marriage for many represents the union of two people and the start of a lifetime together. But for various reasons, many marriages nowadays don't last a lifetime. More than 90% of people in Western cultures marry by the age of 50, and approximately 40 to 50% of those marriages end with divorce. In fact, because of the pandemic, data shows that divorce agreement sales have increased by 34% in April 2020 compared to April 2019. It is an unfortunate fact to face, but divorce is becoming a more frequent event in people's lives, and with it come some lasting effects. It is obvious that a divorce affects the two parties involved, but what about the kids? It's easy to see how the divorce affects children on a surface level. Some kids might receive 2 birthday cards instead of 1. Others might commute between their parents' households trying to equally split their time. Many of us are familiar with these superficial impacts of divorce, but not so much with the internal effects. Research has shown that going through a divorce as a kid can heighten emotional stress and sometimes cause trauma later down the road. As divorce became more frequent, it quickly grew into one of the most common adversities a child can face. It is because of this climbing prevalence that researchers began to question, how exactly is divorce affecting children? Much research has been conducted looking into the immediate mental and social effects of divorce on a child. In 1981, Fellner and colleagues found that children exposed to divorce early in their life misbehaved more in the classroom. Later on in 1989, Tweed and colleagues found that many children had panic attacks or other panic-related disorders up to 6 months after a divorce. The short-term impacts of divorce on children have been extensively researched. But how a divorce can affect a child in the long run is not quite clear. Researchers have now begun looking into the connection between parental divorce and child psychopathology. But wait, what is psychopathology? Psychopathology can be generalized as the study of problems relating to mental health and illness. It covers topics from the development of cognitive disorders all the way through the treatments necessary to recover from said illnesses. Most of the specific disorders researchers focus on are depression, anxiety, alcohol abuse or dependence, psychosis, chronic stress, and schizophrenia. These mental illnesses and disorders can range in severity and affect each person differently. They consistently come up in research and seem to be the bulk of any long-term consequence of divorce. There is a consensus in the field that divorce contributes to the development of mental illnesses and disorders in children. In 2019, Sean and colleagues conducted a study evaluating the mental health and stability of young women whose parents divorced in childhood. When looking at the evaluations, they found that girls with divorced parents reported more depressive symptoms and scored higher on attachment anxiety evaluations than girls whose parents did not divorce. This finding resembles the findings of many other studies. Tebeka and colleagues gathered massive amounts of data in 2016 and found that among people whose parents divorced as a kid, 66.2% were diagnosed with psychiatric disorders. This was significantly greater than the 51% of people who had married parents. In 2020, ARB and colleagues conducted a study looking at how having divorced parents relates to the risk of psychosis. They found that the risk of psychosis increased by 53% in a person if their parents divorced in childhood. While all of these studies focus on different mental illnesses, they all agree that enduring a parental divorce as a kid leaves you more vulnerable to these illnesses. It makes sense that going through something as stressful as a divorce, especially as a kid, can compromise your mental health. These results paint a pretty dismal picture for those with divorced parents, but these results may not tell the whole story. One major confounding factor that many researchers know is how the family interacted with each other before the divorce. Looking into the parent-to-parent dynamics as well as the parent-to-child dynamics can change the whole story. Investigating these relationships would help experts know if previously existing stressors, besides the divorce, left the child vulnerable to developing mental illnesses or disorders. These stressors include physical or emotional abuse, frequent arguing, neglect, and many more. For example, imagine a family where the parents were constantly fighting in front of the kid and would often neglect them. Then the couple gets a divorce. It is unfair to say that any mental health issues that the kid faced later on was due to purely just the divorce. The rough family dynamic was already setting them up for poor mental health. There are other factors to consider when looking at the effects of divorce on a child's psychopathology. These include socioeconomic status, age during the divorce, and parent psychopathology. The first factor, socioeconomic status, can play a major role in a divorce and consequently the child's mental health. According to a Northwestern Mutual study, money is the #1 cause of stress among Americans, by a large margin. In a case where a family is financially stable, a divorce might not cause as much stress as it would for a family whose money is tight. Money would also be a source of those pre-divorce stressors covered earlier. The age of the kid when the divorce happens can also determine how the child adjusts to the divorce. Obviously, as a child ages, they gain maturity and understanding of situations that involve them. A 5-year-old will remember their parents' divorce differently compared to how a 13-year-old would. The last factor to consider is parent psychopathology. Instead of divorce, the reason behind a child's psychopathology may be because of genetics. If either of their parents already had a mental illness, such as depression, their child may develop the same disorder, regardless of if a divorce took place or not. In a study done in 2012, Vasura and colleagues examined how divorce is connected to depression across 3 generations. They concluded that if either of the parents had depression, a divorce did not impact the child's psychopathology. They reasoned that the family risk of depression overpowered the negative effects that they expected the divorce to have. In a general sense, research has shown that a divorce negatively impacts a child's development of mental illnesses and disorders. Now, the question we ask is, what can we do with this information? Research in this field is channeled into creating supportive facilitation groups for kids. These facilitation groups commonly take form as an after-school meeting of just the kids and trained professionals. Here, kids of divorce can express any emotion they have and feel understood by their peers and compassionate mentors. Many of these types of programs have seen great success and received positive feedback from parents. As more research becomes available, more preventative measures can be put into place to help kids cope with their personal divorce struggles. In summary, the stress and negative feelings that come with the divorce impact the mental health of the kids involved. The research shows that such an event does in fact subject kids to developing psychological disorders and illnesses. But just because one goes through a divorce does not mean that they will go through all of this too. In such a somber field of study, each discovery can be used towards a good cause. With such a common event as divorce, the work is worth the effort and the quest for knowledge shall continue.